Yeah, combating and managing it is very cost effective. In fact, that's the way to go. Because if you don't first try to prevent it, and then you manage when anything which comes outward, and then you leave it. That let's leave it, and then whatever will happen will happen. It means you government or the hospital or whoever is running the health system will be spending a lot of money. It's very expensive just leaving it like that. So in any other way, we have to make sure that we combat it. And so that's why we have to have an action plan and make sure you follow the action plan, the strategies that you are supposed to use. So it's very important that you have to combat and manage. So anybody who, for one reason or the other, becomes resistant, you have to manage the person as quickly as possible. One, so that you don't lose life, which is very, you can't cost life. You can't put any price on somebody's life. And if you don't manage it very well, it means the person will have septicemia and die from septicemia. So that's the reason why you have to do it. And once managing it, it's also very expensive. That's why we have to do everything possible to make sure that AMR is combated and prevented. And we can do that one through having a very strict infection prevention and control policies in place and following it and making sure that some people are also monitoring whatever is happening in the higher facilities so far as infection prevention and control is concerned. For example, recently during the COVID-19, especially the vaccines that we are deploying now, you have to go through strict infection prevention and control so that you don't give anything to a patient or somebody who is coming. In fact, they are not even patients. Somebody who is coming for a COVID vaccine is not sick. So you don't want, after giving the COVID vaccine, the patient develops, for example, infection at the site of the injection, which will lead to more serious issues of septicemia and the patient dying from it. Because the patient was not sick, he came to you and they have a very severe vaccine effect following adverse effect following immunization or vaccination. Then it becomes a problem for everybody. In every health facility, there's supposed to be an infection prevention control committee, which normally is made up of a clinician, a nurse, and then also a laboratory person. And they're supposed to have in every hospital and every health facility to appoint an infection prevention and control coordinator who goes around, monitors whatever is happening in the hospital. If people are following hand washing, wearing of gloves and all sorts of things, and making sure that if you are giving any injection, you follow exactly what you're supposed to do. If you touch any patient, you have to make sure that the next patient, you have to wash your hands. Luckily, it's also part, if you look at what is happening in the protocols of COVID. Yeah, see, washing hands, using sanitizer, wearing gloves, wearing masks, and all this. And these are all part of it. So it's the responsibility of every health facility, for that matter, from the chiefs right down to the teaching hospitals. And secondly, we also have infection prevention control at the regional level and also at the national level in the health institution. For example, Ghana Health Service, under the division of institutional care division, has a deputy director, clinical care, who is directly, the quality assurance, who is directly in charge of infection prevention and control. And if you go to the national level at the Ministry of Health, there's also a quality assurance team, which also take care of the infection prevention and control in the health system. So they do the major health facilities and the agency checks, make sure they monitor it and then evaluate it and let people know what they are doing right and what they are doing wrong. If you come to the National Ghana Health Service aspect, they also do for the regions, and the regions will then go down and do it for their districts, and districts goes into the institutions to make sure that they are monitoring and also evaluating infection prevention and control. So it's in all aspects of healthcare system. We do infection prevention control. I think so far so good. From the reports that we see, they've been evaluating it regularly. They've been going around teaching people I know people have gone to Japan even to learn their Kaiser, 5 Kaiser ways of doing things, and make sure that they take an aspect of infection prevention and control and deal with it. And any time that you see the hospital-acquired infection is going up, or for example, very simple thing is you look at post-operative operation infections. Then you go in and find out what went wrong, what is happening, what can you do better. And then you put it back into the policy and make sure that maybe you have to twist this one here and twist this one here to make it work properly. So it's a continuous process and it's going on and it's going on very well. But we need always to improve on whatever that we are doing. We set the standards and make sure that the standards are followed. But I see all these things, the standards also go with the supplies. It's very, very important. So if you ask somebody to be washing the hands regularly, to be wearing gloves, to be wearing masks when he's going to open wounds or going to dress wounds, then what it means is that those supplies should be available. The same thing, you have to get the right infrastructure in place. If you need to have the laboratories working, you have to be buying the laboratory kits and the laboratory reagents for the laboratory people to work to make sure that we don't prescribe antibiotics when you don't have any laboratory backing. You also have to make sure that you have the requisite skilled workers in place, especially clinicians, who understand what the use of antibiotics vis-a-vis infections are concerned. And then the nurses are also there to give the right amount and the right dosage at the right times. Because antibiotics are given over a period of time. If it is 6 hours, you have to give it 6 hours. If it's 8 hours, you have to give it 8 hours. And also more importantly, the patient has to also to be educated anytime that you prescribe antibiotic for the patient. Both the prescribing physician and also the pharmacist. So they have to educate the patients how to take the antibiotics, how many times a day. So most importantly, even at what time that you have to take it and for how long. You don't have to take antibiotics for 1 day, 2 days. Oh, my signs and symptoms have gone down, so I've stopped taking it. That can create antimicrobial resistance. And then make sure that the hospital authorities, the management of the health facilities are also bringing in the right types of antibiotics. They are not fake. They can be used properly by the patients. And patients don't also work because the regulatory system should work, both the pharmacy council and also the FDA, to make sure that the antibiotics which are in the stores are prescribed. Those pharmacy shops which are not supposed to, or chemical shops are not supposed to have antibiotics there because they are prescription drugs, don't keep antibiotics on their shelves. And then the shelf life of the antibiotics should also be watched so that expiry drugs should not be used. All these things are the work of the regulatory bodies, both Pharmacy Council and Food and Drugs Authority, and even Health Facility Regulatory Agency, HIFRA, also have to make sure that when you open a pharmacy shop or you open a chemical shop, the right people are working there at the right places, keeping the drugs at the right times and at the right temperatures, so that we don't have fake drugs, we don't have drugs which are expired, we don't have drugs which are no more potent than being given to patients. Yeah, there's a mechanism in place. And as I said, that one is a regulatory activity of the Pharmacy Council. They go from time to time to make sure that fake drugs are not, or counterfeit drugs are not on the shelves of pharmacy shops and also of chemical sellers. And they destroy them from time to time. The same thing with Food and Drugs Authority. They also go there to make sure that the drugs are well kept. And the Pharmacy Council go there to make sure that the right people are dispensing the right medicines and they know what they are dispensing. So they all work together to make sure that the drugs are kept safe and also are not allowed to expire and be given to patients. And then the HIFRA, Health Facility Regulatory Authority, can go in there and close any shop, other pharmacy shop or chemical shop, which is not following the regulations. And more importantly, you see, even how the drugs come into the country, that's also the work of Food and Drugs Authority. So at the port of entry, there are always Food and Drug Authority personnel there who will check that any medicine which is coming into the system is well regulated before they come in. For example, vaccines. Any vaccine which is coming into the country is checked with the batch number, the manufacturer's details, and also they also check the expiry date, they check the manufacturer's date, and they check if it is a cold chain system, how it was stored, how it was also stored and transported before it reached the country, before they release the medicines for whoever has bought it in to go and give. If it's vaccine, before they release it to Ghana Health Service expanded program on immunization.